Hello, everybody. Welcome. Thank you for joining me today to ilike Organic Skincare's presentation of hyperpigmentation, symptoms, causes, and treatments. And I just wanted to go through a small introduction. So welcome, everybody. My name is Jessica Heron, National Educator with ilike Organic Skincare and Pure Spa Organics. Thank you so much for taking the time to join me today. Let's discuss what we are going to discuss in today's webinar. What is hyperpigmentation? Sort of that classic definition of what hyperpigmentation is. Also, the causes of hyperpigmentation. What are some of the triggers and also the symptoms? So, differentiating between the types of hyperpigmentation disorders, the signs and their symptoms, being able to recognize the different types of hyperpigmentation. So that way you're better to come up with the best treatments in order to treat hyperpigmentation. Also identifying the different types of hyperpigmentation, and that also comes into play with recognizing the types of hyperpigmentation disorder signs and symptoms, and the tools that you can use to help you identify that hyperpigmentation. Also, we're going to review the common treatments that are utilized in medical treatments and also in aesthetic treatments. Common treatments that are utilized to treat hyperpigmentation, and we'll overview those. What are some of the advantages and also the disadvantages of those common treatments as well? And of course, reviewing the treatments from ilike Organic Skincare. The treatments that our product line, which are natural and organic solutions, that offer you an alternative to some of the other common treatments that we'll be overviewing. We're also going to provide you with a live demonstration of an ilike oxygen lightening facial treatment. And I'll also discuss some of the recommendations for series of treatments in order to achieve the best effects for helping to address and lighten a client's hyperpigmentation. So let's overview what is hyperpigmentation. Hyperpigmentation is the darkening of an area of skin or nails by increased melanin. Melanin is a class of pigment that's responsible for producing color in the body in places such as the eyes, the skin, and the hair. So not only does the melanin affect the largest organ of the body, the skin, but of course we have melanin in our hair and in our eyes that produce color, which would be the melanin. Hyperpigmentation may also be caused by sun damage, inflammation, or other skin injuries, including those that are related to acne lesions as well. So there's a couple of different types of causes that can trigger the hyperpigmentation, which is, of course, darkening of the hair and skin and nails, but it's usually like a mist pattern or an asymmetrical pattern, a blotching of the skin, freckling are some of these signs to look out for. Darker complexions, such as Asian, Mediterranean, African skin tones, are more prone to hyperpigmentation, especially when overexposed in the sun. Because these types of cultures have a darker complexion, they have more melanin in the skin. So when there is an injury or a wound on the skin, the defense mechanism is to produce more of these melanocytes. And so because the skin tone is already a darker complexion, what happens is the complexion becomes even darker. So, and it's an uneven hyperpigmentation look to the skin and sometimes very dark lesions. A simple way to approach hyperpigmentation is to consider whether the increase in color is caused by an increase in melanin, an increase in melanocytes, or another substance that may add color to the skin. So a thorough consultation and a skin analysis is imperative. And later in the presentation, we'll learn about those related symptoms to assist you with determining the specific causes. And also kind of differentiating what those symptoms will look like and what may cause them as well, of course. Hyperpigmentation is associated with a number of diseases or conditions as well that affect the color of the skin. And we'll be learning about those as well later in the presentation. So melanin is produced by melanocytes at the lower layer of the epidermis, which is the basal layer. And in the basal layer is composed of keratinocytes and also melanocytes. As the body ages, melanocyte distribution becomes less diffuse, and its regulation is less controlled by the body. Also, UV light stimulates melanocyte activity, and where concentrations of the cells are denser than surrounding areas, hyperpigmentation can be affected. Causes of hyperpigmentation. The cause of hyperpigmentation is usually traced to the activity and the presence of melanocytes. Melanocytes is one of the most important cells in the body. They're derived embryonically from neural cells that migrate into the basal layer of the epidermis. In the epidermis, there are about 1,000 to 2,000 melanocytes per square millimeter of the skin. They make up to about 5 to 10% of the cells in the basal layer of the epidermis. Okay. Melanocytes continuously produce melanosomes, organelles that are transferred to keratinocytes, which are dead skin cells. And those dead skin cells build up on top of each other. And of course, dead skin cells, the more that we can exfoliate these dead skin cells, the smoother, the softer, and the more even our complexion and color tone can be. Of course, there are different degrees of that exfoliation, and different skin types and skin conditions can only take so much exfoliation, but also is something that will assist in helping to remove those stained dead skin cells from the hyperpigmentation. The melanosomes convert tyrosine, a precursor of melanin, to melanin, giving it skin color. Under the stimulus of hormones or irritation, the production of melanosomes increases, leading to hyperpigmentation. So here's a little diagram of where you can see in the basal layer of the skin, located in the epidermis of the skin. The lower level of the epidermis are the melanocytes and the melanin. So you can see the little black, but the darker cells down here at the lower level of the epidermis. And that's where it begins. All right, what other causes of hyperpigmentation? UV exposure. The use of tanning beds and unprotected UV exposure. Lack of sunscreen usage is usually number one in the sun and UV exposure. Likelihood of burning when exposed to UV. Also, medical conditions that can cause hyperpigmentation, such as Addison's disease, which is an adrenal insufficiency, Cushing's disease, which is a hormonal disorder caused by high levels of the hormone cortisol. Also, hyperthyroidism, an overactive thyroid, could be another cause. Recent pregnancy or the use of birth control pills or hormone replacement. So some type of a hormonal supplement or an imbalance can also cause the hyperpigmentation. Hyperpigmentation that appears symmetrical, mask-like, can be nearly certain of melasma, which is like the pregnancy masks, so-called. And then also hyperpigmentation is a side effect of a number of medications, including but not limited to antibiotics, cancer drugs, and anti-seizure drugs as well. So let's take a look at some of the types of hyperpigmentation and the signs and their symptoms. On this first slide of the signs and symptoms, we're looking at birthmarks, and then second, diffuse hyperpigmentation. Birthmarks, also known as café au lait macules, or flat macules that usually occur on the trunk of the body, can have a smooth or an irregular border. Hyperpigmentation is caused by increased melanin and melanocytes and basal keratinocytes. Café au lait macules may be a sign of neurofibromatosis, a genetic disorder that disrupts cell growth in your nervous system, causing tumors to form on nerve tissue. That could be a sign. The presence of 6 or more macules is one criteria, or growing freckling is also another. Usually there's no treatment that is needed. It's something that happens early on at birth. They don't have any negative side effects or links to any melanomas, which are skin cancer. So really typically, unless it's something that's really cosmetically deforming somebody and wants to remove it, it can happen, but usually no treatment is usually needed. Diffuse hyperpigmentation. This is, it may have a systemic cause, affecting a group or a system in the body. Like Addison's disease, for example, a primary adrenal deficiency. Adrenals control the strength of the immune system. So if the adrenal functions are down, that will put us more at risk for sickness and illness as well, and other types of illnesses. Hyperthyroidism, an overactive thyroid. Our thyroid regulates the body's metabolism. So that's basically when the thyroid is working too fast, it's producing too much thyroid, and the metabolism is working too quickly. Hemochromatosis, when there's too much iron in the body. It may also occur because of a medication side effect, which could be associated with the systemic causes. Cosmetic treatment with bleaching agents or lasers can be used to decrease the pigmentation of, like the freckles and the lentigines. And so these are diagrams that you can see here of what that pigmentation looks like. The flat birthmarks, diffuse hyperpigmentation tends to be a little bit more spread out and also more blotchy looking as well. Let's take a look at some other signs and symptoms. Chronic sun exposure, also phototoxic reactions. Chronic sun exposure. Lesions from the chronic sun exposure usually occur because of solar radiation or tanning beds. Causes an increase in melanin production, which causes uniform tanning in most people, but leads to freckling in some. And so you can see in the diagram directly to the right of how the chronic sun exposure or the tanning beds can cause an uneven blotching, freckling in the skin. Black macules may also occur, which have increased numbers of melanocytes that produce very dense epidermal deposits of melanin, where they do look very dark in color and also very, pretty much almost to that blackish tone. Both freckles and black macules are benign, and oftentimes there are too many to count, especially with freckles. If the lesions are larger than several millimeters or have abnormal coloration, surgical removal may be required because of possible malignancy, which is skin cancer. And there will be a little bit of a guideline we'll go over in order to be able to recognize the asymmetry in some of the possible malignancies that you may come across, and to be able to recognize that. So lesions from phototoxic reactions, and you can see the image here to the right below chronic sun exposure is an example of hyperpigmentation caused by phototoxic reactions from the use of systemic or topical medications. And basically it's a photosensitivity that can happen. Contact with certain plants or foods in conjunction with sun exposure could be allergic reactions or an intolerance to certain plants or foods. Inflammatory response when exposed to sun, most commonly called photosensitivity, is what I was just mentioning earlier in that first bullet point about phototoxic reactions. Become sensitive in the sun, and the medications, this is a side effect of the systemic medications, or whether they're internal or topical. Fixed drug eruptions and photosensitivity reactions. The pigmentation is often in the lower levels of the dermis, which is a much deeper hyperpigmentation. The dermis is below our epidermis, which is the top layer of the skin, and the dermis, when the hyperpigmentation is below, it is almost impossible to treat because it's so deep. And currently, there really aren't any available treatments that are able to penetrate the lower layers of the skin. This should be consulted with a physician to see if medication may be discontinued in order to improve the hyperpigmentation. But of course, because these are medical types of drugs that a doctor has prescribed, this would be something that you would want them and yourself to consult with the physician to see if those treatments can be discontinued. But I wouldn't ever recommend that a client discontinue their medications and interfere with the physician's treatment. Always wear an SPF 15 or higher when taking the medication that can cause photosensitivity. And that should always be recommended when they're taking this type of drug. Okay, so let's take a look at other signs and symptoms that could link to skin cancer. Lesions that are malignant and then also benign. And malignant is skin cancer and benign is not. Melanoma. It's a localized, hyperpigmented, or irregularly pigmented lesion that is new and arises within a mole, causing pain or itching, and could be a malignant melanoma, skin cancer. This kind of lesion that you can see up here on the top left-hand side of the screen must be removed to prevent the spread of the skin cancer. Now, if it's benign, like the one on the right, this would be something that you don't necessarily have to be as worried about, but it would be something that the physician would maybe watch to see if there are changes in the asymmetry with this type of lesion. This is where you can see where on the malignant melanoma that there is a irregular border, that there is no symmetry left. Here it's a very symmetrical, round, benign looking lesion, more of like a black macule, whereas the malignant is asymmetric and has an irregular border. And also you can see the different variations of color from light brown to medium to dark brown. So those are also some of the things that you want to watch out for. And then when you see it, refer them directly to a physician immediately. Let's take a look at velvety hyperpigmentation, usually related to insulin resistance or obesity. Ranges in appearance from thickened, velvety brown, streaking to a leathery, verrucous, pulpomaceous lesion. Insulin, of course, is a hormone that's very important for our metabolism and the utilization of energy, especially glucose. It's produced in the pancreas, and it causes the liver, muscle, and fat tissues to take glucose from the blood and convert it into glycogen, so it can be stored into the livers and in the muscles. Insulin prevents the utilization of fat as an energy source. In absence of insulin, where glucose is low, the body begins to use fat as an energy source. Failure of insulin production can lead to diabetes. And typically this is the type of hyperpigmentation that you will see associated with this insulin imbalance. It commonly occurs on the neck or in the skin folds, but may develop on other body parts as well. Like the underarms is typical and a very common area. Treatment is usually directed at the underlying cause by the physician or medical doctor. And this is some of the common velvety hyperpigmentation that you might see, and this definitely could be a sign of that insulin resistance. All right, let's take a look at melasma. Melasma or cloasma, called the pregnancy mask. This is probably one of the more severe images of a pregnancy mask, but it's a good one because it shows you the typical pattern of where pregnancy masks can kind of take place. Typically, it's the cheeks, along the upper lip, and also along the chin and jawline. Pregnancy or the use of birth control can cause melasma. A localized facial hyperpigmentation is basically what you're seeing in this slide here. Symptoms of melasma may subside after pregnancy, but they can increase with each pregnancy that follows and become more obvious as well. What are the treatment options? Hydroquinone, which is a chemical skin lightening or bleaching agent that is commonly prescribed. Retin-A is a form of kind of an aggressive exfoliator. It's used for different types of skin disorders like acne skin conditions, and it's also used for aging clients as well. But typically it can be also used for melasma or hyperpigmentation. Azelaic acid, glycolic acid, forms of alpha hydroxys that help to provide a stronger exfoliating effect to help to remove some of those stained dead skin cells. Chemical peels and microdermabrasion, which also some deeper types of superficial peels that you get at the dermatologists, which are much deeper than some of the AHA peels that estheticians can perform. And microdermabrasion treatment, which is more of a physical exfoliation versus a chemical. Diabetic dermopathy, pigmented pretibial papules, develops in up to 70% of patients with diabetes. The condition usually affects the skin on the lower limbs or the legs and starts as a pink or brown eruption and progresses to a macular brown dermatitis. The exact cause of the lesions is unknown. The treatment focuses on the patient's diabetes by their physician. And here's some of the typical hyperpigmentation you would see in a diabetic client on those lower limbs. It's very, very common. And you might see it in somebody who may come in for a body treatment, more than someone who's coming in for their facials, because again, it affects more of the lower part of the trunk of the body and the lower limbs. Post-inflammatory hyperpigmentation. A lot of times what we're able to treat as estheticians, that's not a medical condition, is like, it is a result of acne, which is a medical condition. But at this point, in this phase of the acne, the post-inflammatory hyperpigmentation, sun damage, melasma or chloasma, is much easily treatable in the spa treatments. Now, again, like the medical conditions, the insulin resistance, the diabetes, those are type of medical conditions that you would be closely working with their physician in order to make sure that you're providing the safest and the right treatments for that client. Some of these types of clients that come in with this type of post-inflammatory hyperpigmentation will be a little bit easier to treat because it's a little bit more temporary. It's trauma, it's a skin irritation, and dermatosis can lead to post-inflammatory hyperpigmentation or even hypopigmentation, the loss of skin color. With time, the pigment changes, usually tends to normalize after a while, but it can take a while. And then sometimes that pigmentation can be permanent as well. But typically this is one of the easiest types of hyperpigmentation to treat. Hypopigmentation, although, is a little bit different, where it's the reverse of skin color or the loss, should be performed by a cosmetic dermatologist, as this is a medical condition that is not as easily as treatable topically by an esthetician. So I would highly recommend that they can consult with a cosmetic dermatologist physician in order to treat hypopigmentation. What are the treatment options? Hydroquinone, which is that common chemical bleaching lightening agent that's prescribed quite often. Retin-A, azelaic acid, and glycolic acid, AHAs, chemical peels, and microdermabrasion are some of the other treatment options as well. Common disorder signs and symptoms. Follow the ABCD rule for identifying signs and symptoms. This will really kind of be a helpful tool in identifying whether a lesion is malignant or benign. So A, asymmetry. One half of the mole does not match the other half. We were talking about that irregularity in the border. Border irregularity is the next one. The edges of the mole are irregular, ragged, blurred, or notched. The color of the mole is not the same. There may be differing shades of tan, brown, or black, like we saw earlier in the slide that contained the malignant melanoma and the benign one. The difference is in that, you know, transitioning from a lighter brown to a medium or sometimes black. And even sometimes there could be patches of even other colors like red, blue, or even white. The diameter. The mole is larger than 6 millimeters, approximately 1 1/4 inch. Recent studies are finding more melanomas between 3 and 6 millimeters, so they're looking a little smaller even now. And some melanomas don't typically sometimes even fit the ABCD rule. So it is particularly important to be aware of changes in the skin lesions or any new lesions. So those are some of the things to watch out for, but this ABCD rule helps you remember what to it gives you this nice tool to keep in mind in order to identify the signs and symptoms of melanomas. So identifying the hyperpigmentation. Of course, a very detailed skin analysis is crucial. And determining the patient's Fitzpatrick skin type, which is a scale that's used to decipher how light or dark the skin is, and also how much they would hyperpigment. Because skin that is lighter is easier to treat than those that have the type 5 and higher, which is a darker complexion, requires a more delicate approach. Because at that point in time when the skin is darker, people who have hereditarily a darker skin tone will actually pigment much easier. And the approach has to be a little bit more safe and a little bit more delicate, and it takes a little bit more time as well. Using a Woods lamp and a magnifying lamp to determine the severity of the hyperpigmentation and whether it is isolated to the epidermal layer or goes deeper to the dermis. These are tools that are going to help you with identifying what type of hyperpigmentation it is and how deep the pigmentation goes to the epidermal layers, or does it go deeper to the dermis. The Woods lamp is a really wonderful tool because it has color coding that helps you immediately identify how deep the pigmentation goes. So I really highly recommend to always have that as a tool for you to be able to identify different types of hyperpigmentation. The esthetician should also look for the severity of the condition and also look for clues to the origin of the problem to determine if a separate issue must be treated. So, of course, doing this thorough skin analysis will help you determine these, if a different approach is needed, and also if they have to seek the treatment of a physician or a doctor as well. Decipher a lifestyle, a medical or genetic cause of the hyperpigmentation. It's basically kind of just what I was just talking about. Being able to understand if there is a medical condition, if it's hereditary, genetic, or if it's something that's happening from lifestyle. Could be some extrinsic damage, but also could be intrinsic as well. So let's take a look at the different types of Fitzpatrick hyperpigmentation, or skin scale, going from type 1 to type 6. So type 1, typically very light and fair in skin, and also very light hair, blonde hair, and green eyes. And then typical type Fitzpatrick type 2 could be blonde or red hair with also blue eyes as well. So it's a scale used to measure the amount of pigment in the skin and the skin type's ability to tolerate the sun. So type 1, white skin color, blonde hair and green eyes, always burns and freckles, English, Scottish descent. Type 2 is typically white skin color as well, blonde or red hair, green, blue eyes, always burns, freckles, difficult to tan, and rarely tans. Northern European descent could be the background of their culture. Let's take a look at type 3. White skin color, but has brown hair, brown eyes, and type 4 is more of a brown skin color, brown hair, brown eyes. Type 3, white skin color, blonde, brown hair, and blue-brown eyes. Tans after several burns, may freckle. Type 4, typically brown skin, brown hair, and brown eyes. Tans more than the average person would, and very easily sometimes, but rarely burns. So rarely freckles. You'll see the freckling happening more in types 1 and 2. And type 3 may freckle, but type 4, 5, and 6 rarely freckle. Type 5, you get a little bit of darker skin tone or African descent. And type 6 is, of course, much darker. And skin type 5, dark brown skin color, brown, black hair, and brown eyes, tans with ease, rarely burns. And these are the, from type 4 to type 5 and 6 are going to be the skin tones that hyperpigment easily and are much more difficult to treat. Type 5 does not freckle. Type 6, black skin color, black hair, brown black eyes, tans, never burns. Deeply pigmented and never ever freckles. So this will give you a really good tool to be able to see how easily somebody tans, and also too, how easily do they hyperpigment as well, and how easy is it going to be to treat. As we were just mentioning, types 1, 2, and 3 are going to be easier to treat than types 4, 5, and 6. So what are those common treatments that we can utilize in medical treatments and also in aesthetic treatments? And what are their advantages and disadvantages? There are 2 categories of treatment: topical agents and also non-surgical procedures. The best results are via a combination of the 2, actually, doing topical and non-surgical. Active ingredients in topical formulations work by affecting tyrosinase, enzyme found in melanocytes that stimulate the production of melanin. There are a lot of topical formulations that provide tyrosinase inhibitors to prevent that action from occurring. The ongoing use of a skin lightener is necessary when melanin production needs to be regulated. And because a lot of times the hyperpigmentation is permanent, an ongoing use of the skin lightener will sometimes go on and on and on. And they, once they start to discontinue the use of this lightener, the hyperpigmentation can resurface again. Basically, it's a suppressant. Skin lighteners are kind of pushing down the pigmentation below the top layers of the skin. The exfoliation that commonly is done in treatments for hyperpigmentation is to help to remove those stained layers of dead skin cells that also make the hyperpigmentation look more dominant. There's topical agents, of course, we were just talking about. Hydroquinone, a dermatologic bleaching agent. The advantages are approved by the FDA, often formulated with antioxidants and retinoids and hydroxy acids to improve results. But there are disadvantages, of course. It can be very irritating, and it may cause serious reactions when used in high concentrations. It also should not be used during pregnancy. So that does eliminate a portion of the clients that are affected by hyperpigmentation, as we just learned earlier about melasma and chloasma, and how pregnancy can bring on that type of hyperpigmentation. So this can eliminate that type of clientele altogether. So there right away that they are missing out on something they could possibly use. It's not typically the safest or the best bleaching agent to use. In some countries, hydroquinone has been banned. It is still approved here in the United States by the FDA. It's quite interesting. Azelaic acid. It's naturally present in the skin and is also found in other sources, including wheat, rye, and barley. The advantages of azelaic acid are proven to be beneficial in the treatment of hyperpigmentation. Studies showed results similar to 4% hydroquinone and without side effects. But there are disadvantages. Those who have dark skin are at risk of having hypopigmentation, losing skin color, and also those who have delicate skin or suffer from dermatitis or eczema, the treatment may cause dermatitis. So it would be a trigger. So that's not something that also, so there again, we have a couple of different types of clients who cannot use this kind of ingredient. That would be contraindicated. And of course, should not be used during pregnancy. Another contraindication to azelaic acid. AHA treatments: glycolic acid, lactic acid, mandelic acid. What are the advantages? They remove already stained corneum cells. So those are the dead, the skin cells, the dead skin cells that are stained on the outer layer of the epidermis. And it can help to remove by the exfoliation process that they provide. Suppresses melanin production in the melanocytes also. So it helps to push that production of the melanocytes deeper down below. And premixed solutions that include a combination of melanin suppressants and a combination of the AHAs together. There are common treatments out in the market that combine both. But what are the disadvantages? Of course, there's always going to be one. Can cause photosensitivity. So while you're going through the treatments, exposure to UV radiation or being out in the sun can cause hyperpigmentation to become even worse. Superficial peels, which are deeper exfoliations, commonly performed at a doctor's office or a dermatologist. The advantages: only remove cells from the epidermis, so it can be a little bit more safer type of a stronger type of a peel. Evens the surface of the skin. So we're talking like, some Jesner type of peels. Those are that's a common one that's used quite a bit. Smooths the appearance of the skin. Some of the disadvantages would be pregnancy. If you're pregnant, you cannot use it. Somebody who has maybe heart problems. The physiological effects are negative when someone has heart problems. History of medical problems such as eczema, lupus, some autoimmune disorders, seborrhea, rosacea, psoriasis, skin infections, mental disorders, hyperallergenic skin, allergic skin, and other systemic problems. We would want to not use these types of peels on clients with this type of medical history. History of herpes, because the deeper peels and the superficial peel can be an onset of the virus to spread and to trigger it to come out. Accutane users, people who are taking the internal drug for acne, Accutane, their skin has already become thinned and very dehydrated and dried out. I would say too, if they're already using a retinol or a retin-A, this would also be a contraindication to doing some of the AHA and the superficial peels as well. Retin-A users, yeah, we were just talking about that. Some other common treatments would be kojic acid. These are some more natural solutions that that you'll notice that are very common ingredients in hyperpigmentation treatments over the counter. skincare products that you're going to find are a little bit more safer, and some other alternative natural solutions. Kojic acid is an all-natural compound derived from fungi, sort of like a mushroom. The advantages are naturally occurring, that features an efficacy similar to hydroquinone, but it's a natural alternative. Both hydroquinone and kojic acid, when combined together, perform better when kojic acid is added to a formulation. The disadvantage, though, is that it may cause contact dermatitis, again, because of the hydroquinone. Also, kojic acid can also be a trigger to cause dermatitis and irritated, itching skin. Mandelic acid, it's an aromatic alpha hydroxy acid. The advantages, AHA derived from almonds that treats all types of hyperpigmentation. Often combined with salicylic acid, it performs as a peel and has had fewer side effects than a glycolic peel. So it's a little bit more of a gentle type of an alpha hydroxy peel. There's better efficacy, no specific side effects or warnings, although as there is a risk of photosensitivity, as with all AHA peels. So again, even though this is one of the more gentler forms, a safer form without side effects, there still is risk of photosensitivity, and sun protection is a must whenever using these types of peels on the skin, and also educating them about the risk of their photosensitivities. Non-surgical procedures, like microdermabrasion, which is a process of physically exfoliating the skin, not using a topical chemical exfoliator or a product. It is a procedure that is done with an electrical device. Typically, microdermabrasion uses what they compare to like a sandblasting. There are little fine crystals. There are now crystal-free methods with a diamond tip as well. So there are two different types of machines now out there. And also now they are doing treatments that are similar to a, without having the sandblasting and without a physical abrasion. They are using oxygenated type of equipment as well. And that's also very new too out there, which is a very popular, more newer, common type of non-surgical procedure that's similar to microdermabrasion. The advantages are a good solution for clients when chemical exfoliation is not suitable, documented to reduce pigmented lesions. So there is evidence that shows that it has reduced the appearance of hyperpigmentation. Superficial acne scarring, some of that raised acne as well. Raised scars. Produces collagen. It helps to stimulate collagen production, which collagen is a molecule that aids in tightening and elasticizing our skin's tissues. So this is a very important piece to a very young-looking, supple skin, and so it is shown, studies show that microdermabrasion can stimulate that collagen production. It can be also used with other devices like LED and IPL, light-emitting diodes, and IPL lasers as well. The disadvantages: aggressive techniques can cause pinpoint bleeding. So if it is a technician that is using an aggressive technique on skin that's too delicate for it, can also cause some pinpoint bleeding, redness and irritation, infection if it's not done in a sanitary method, hyperpigmentation, because it can cause photosensitivity as well. So just like chemical peels, microdermabrasion can also, photosensitivity can be and a side effect of the treatment, microdermabrasion. So common other treatments are light-emitting diodes, LED, light-activated facial rejuvenation that activates the skin cells, so it's rejuvenating. The advantages are producing new collagen, reduces erythema, that really red inflammation that's caused from lasers or caused from the microdermabrasion, reduces sunburns. Equipment comes in two different styles, in panels and also handheld units. The disadvantages: clients that have seizure disorders are not recommended for treatment because it can be a trigger for seizures. clients with open skin lesions, open wounds or cuts or abrasions, clients using photosensitive medications, for example, like minocycline, a tetracycline drug, clients with autoimmune disorders like HIV, hepatitis B, C, and lupus, and also people who are pregnant. So those are also some contraindications, people who cannot use LED light therapy. IPL facial rejuvenation, which is a non-ablative process involving a laser or a light device to treat the extrinsic and the intrinsic signs of aging, external and internal. Advantages are, treats numerous signs of photo damage, improves the overall texture and tone, can shrink the pore size, increases epidermal collagen formation, so again, stimulating collagen production, diffuses erythema or redness or irritation. Some of the disadvantages are clients who are photosensitive to sunlight, again, cannot use this treatment. Accutane users within the last year. One of the reasons I think, too, because the Accutane thins, dehydrates the skin, and the IPL laser would be too strong for someone on Accutane. History of skin cancer in the treated area. Also, photosensitizing drugs as well. Tanning, people who are doing lots of tanning, the UV beds. And autoimmune disorders like HIV, hepatitis B and C, and lupus, and pregnancy or nursing. Again, those are some contraindications to people who cannot use IPL. So it does, the treatments that we just listed are common treatments that are used. There are advantages which make them, treatments that do work. But then again, it does have disadvantages. So not everybody can do these treatments. Also, people who are prone to keloid scarring, because the laser does involve heat and light. So if you're prone to keloid scarring, those raised, thickened scars, then you have a disadvantage here because you cannot do the IPL, and you are prone to keloid scarring or have a risk of that if the laser is not done correctly either. Psychological disorders as well, because there is a stimulating physiological effect when using a laser or a light. Also, anybody that has recent or ongoing chemical peels or other exfoliating treatments should also be warned about not doing the IPL until they discontinue the use of the chemical peels or other deeper exfoliating treatments. This is very good to understand, too, some of these disadvantages and contraindications, because if you're doing those treatments in your spa or in your menu of services, it's good to know what you can and cannot combine. So the treatments from ilike Organic Skincare offer a natural, organic, safe, and non-invasive solution for treating hyperpigmentation. These are products that provide you an alternative, especially for clients that fit into those lists of contraindications that we mentioned with those common treatments. These provide an alternative for a safe alternative and very effective. Our products are highly concentrated, and because of the delicate way that we handle our ingredients, we really protect the molecular structure of the plants that we use in our products. Our products are highly concentrated, so they're very effective and results-driven products. And again, with all treatments for treating hyperpigmentation, it is an ongoing process, and it's not something that you ever stop doing unless you just stop caring about the hyperpigmentation. Some people let it go and really have no cause or reason, but I think, the population out there with uneven blotchy skin tone are always trying to find a solution for evening out and enlightening the pigmentation. So what are the treatments from ilike Organic Skincare? Now let's talk about the ingredients that we commonly use in our products that help with lightening and bleaching and exfoliating the skin. The stonecrop plant, which is a lovely picture here in the very bottom right-hand corner of the screen, is a cousin of the aloe plant. There's about 400 species of aloe plant, and stonecrop is one of them, kind of like a sister or a cousin to the aloe plant. So there's lots of healing and regenerating and soothing and calming effects to the stonecrop plant, but it also contains some natural occurring acids in the stonecrop plant that assist with lightening and brightening, like free amino acids and phenylcarbonic acids and malic and malonic acids. The lemon is a bleaching and a lightening property, contains salicylic acid, which is very clarifying. It's a very toning and tightening ingredient as well, but also helps to prevent oxidation from sun damage. Yogurt. Yogurt is a form of lactic acid. And of course, it comes from organic cow's milk in our products. And the yogurt power peel in our line would be the key ingredient would be yogurt in that product. It has yogurt enzymes, probiotics that are very, very healthy for the skin and antibacterial. And also, of course, you're getting the exfoliating effect in a gentler form, lactic acid, which is very safe for darker complexions as well. So the yogurt power peel can be a really good solution for not only helping to lighten the skin and bleach the skin, but also to help to remove the stained dead skin cells, and then also is very safe and non-invasive treatment for those darker complexions when you have to take that delicate approach. Bearberry, which is a very common herbal ingredient known for tyrosinase inhibitor, so it helps to prevent the signs of hyperpigmentation and helps to lighten and bleach the skin. Horseradish and nasturtium are very high in vitamin C, and vitamin C is not only an antioxidant that helps to protect the cells from premature signs of aging, it's also known as a lightener and a brightener for the skin, and it's also great for collagen production. Lemon balm also assists with lightening, as well as parsley. Parsley is an herb commonly used in cooking, but it also can be used as a wonderful treatment for helping to lighten and reduce the appearance of hyperpigmentation. The overall effects lighten pigment, diminish hyperpigmentation, tighten the pores with acids, hydrate without any heavy oils, vitalize the skin. So we recommend a series of treatments for the best effectiveness, and a simple but a very complete home regime to support the series of treatments that are being done in the spa. What we recommend are our Stone Crop line of products. There is a Stone Crop toner, which is like a toning mist that balances the pH after you cleanse and after you exfoliate. You want to balance the skin's natural pH. Also, this is a wonderful toner to introduce the aromatherapeutic benefits of the Stone Crop. It also helps to remove residue of any of the product that has been missed after cleansing or exfoliating. It also allows for better moisture absorption too as well. So the product has better efficacy, those products that follow afterwards. This Fiber Stone Crop Gel Mask. This is a weekly treatment that you would use once or twice a week that could be used at home in between the series of treatments that would be done in the spa. And it has a very soothing, a very calming effect, but at the same time is helping to lighten and bleach the skin. Brightening Serum is a daily product that's used once, or actually twice a day, underneath the moisturizer. It comes in a 1.2 ounce bottle. It's a gel, liposome gel serum. The liposome molecule is what aids in the active nutrient penetration into the skin. We have all of the lighteners that I mentioned earlier, the lightening herbs in this brightening serum, except for the yogurt. There isn't any yogurt in the brightening serum, but all of the brighteners, the Stone Crop, aloe, the parsley, the acids, also lemon and bearberry are all in the brightening serum. This is the most concentrated home care regime product in the line. It's one of the most important products and should be used daily under the moisturizer twice a day. The moisturizer, Stone Crop Whipped Moisturizer, is in a light whipped formulation. It's ideal for all skin types. It can be great for combination skin types as well. But again, with the Stone Crop ingredients, we're helping and assisting in lightening and brightening the skin. There's also a healing Stone Crop Body Wrap, which can be a wonderful solution in conjunction with the Stone Crop Body Lotion. It can be done professionally in treatment, and then the body lotion can be used at home in between the treatments to support the lightening process. Also, the Daily Men's Moisturizer. This is a lighter whipped formulation of moisturizer. This has the formulation of the Stone Crop line is very light, it's refreshing, it's a very clean scent, and very gender friendly for both genders. So the men's moisturizer has been whipped a little lighter, so that way the texture feels more ideal for a man's preference. Typically we find men don't want to feel their products on the skin. They also don't want anything perfumey or feminine on the skin. And also men spend a lot of time outdoors, I think typically more than women, especially men who work outdoors. And women that work outdoors too as well. This would be a perfect line for them. We picked Stonecrop as part of the men's line because of those factors that, a man's lifestyle typically can be somewhat more prone to hyperpigmentation. Products containing Stonecrop have a keratoplastic, thickening of the keratin layers, astringent effect, regenerating, soothing, and bleaching effects. We also have the apple and lemon line, which contains the apple and lemon the lemon cleansing milk, the apple and lemon gel mask, and the apple and lemon whipped moisturizer. So the lemon cleansing milk is a daily cleanser that can be used twice a day. It also is a wonderful cleanser for toning and tightening the skin, especially for someone who has overactive sebaceous activity or an oilier skin or even a problematic skin can benefit from the lemon. There's a little bit of apple in the lemon cleanser in the lemon cleansing milk that provides a slight exfoliating effect, but very, very low levels of the malic acid is present in the lemon cleanser. It is a little higher in your apple and lemon gel mask, the malic acid, the alpha hydroxy. But combined with the bleaching and lightening effects of the lemon, you have a wonderful refining, softening product that helps to and assists bleaching and lightening the skin. It is a little bit of a stimulating product, the mask, but you'll find that it is very non-invasive. I wouldn't consider it a peel-like product. It is considered a brightening mask and also a clarifying mask. It is a gel mask, so it has more of a jelly consistency that's safe to use also with electrical stimulation. Same goes for the brightening serum. You can also use the brightening serum with LED light therapy or even microcurrent services as well. Can also be very effective for boosting and enhancing the effects of those products, the gel serums and the gel masks. The apple and lemon whipped moisturizer is our third lightest whipped moisturizer. So it is a very light, smooth finish. It's a great moisturizer to control oil and help to reduce the appearance of acne scarring. Same with the mask, that raised acne scarring. The apple lemon line can be perfect for somebody that is experiencing that post-inflammatory hyperpigmentation. The whipped moisturizer could again be wonderful for someone who's oilier combination because its light whipped consistency is very fluffy and light, so it doesn't feel heavy on the skin. And it's non-greasy. Apples contain malic acid, a form of alpha hydroxy that smooths and refines the skin while providing a high level of antioxidant protection as well. Apples are full of antioxidants, vitamin content that help to protect the cells from premature signs of aging. Lemon juice has bleaching, regenerating, moisturizing, and toning effects. It refreshes, it rejuvenates the skin, it also increases its resiliency. Lots of vitamin C in lemons and bioflavonoid content, so you also have some strong antioxidant benefits in the lemons to protect from premature signs of aging as well and UV radiation. It is highly recommended for oily, seborrhea skin affected by acne conditions. Yogurt Power Peel. Lactic acid yogurt peel that softens, soothes, and tightens the skin and refines the pores. That should actually say smooths, I'm sorry. It is a 20% lactic acid peel, and it combines the lightening and bleaching benefits of lemon in it as well. And this is a quick peel. It is not a peel for long treatments. It's fast acting, and the acidity level is very low, so it really works very quickly and is very effective. It can brighten the skin within one treatment, and over time you're going to see a progression of brighter and lighter skin the more often that you use it in a series, and then continue to use it monthly, on a weekly basis, even after a series of treatments that are done in this professional treatment. I'm going to demonstrate the Yogurt Power Peel today in the Oxygen Lightening Facial from ilike, combined with the Cucumber and Parsley Oxygen Lightening Mask. So you'll see the Yogurt Power Peel in action, and I'll demonstrate how to use it properly. You also want to watch out because it's an alpha hydroxy peel. All those disadvantages to alpha hydroxys that we mentioned earlier will go the same for our lactic acid peel as all AHA peels. You want to make sure that it's not an Accutane user, a Retin-A user, anybody who is already doing chemical peels or any stronger chemical peels on the skin. You typically don't have to worry about pregnancy with these peels. because they are from a food source, and typically usually it's salicylic acid is the contraindicated peel to pregnancy. This is a lactic acid, so it would be safe for someone who is pregnant. Rosehip exfoliator. This exfoliator contains a combination of a 5% lactic acid, and lemon is a good option for skin that's too sensitive for the yogurt peel. This is a lower level of lactic acid. It's less stimulating, but it is effective because it does have the lightening benefits of lemon. It combines the vitamin C content in rosehip, and so it has wonderful antioxidant properties. It does use a physical exfoliator, crushed cornmeal, which assists in the exfoliation process and sloughing off dead skin cells, and has the brightening benefits as well. So it's a good alternative to really sensitive skin that cannot use the yogurt peel. And those are weekly products in the home regime, once or twice a week. The cucumber and parsley oxygen lightening treatment. It's a professional treatment designed to promote a bleaching effect through the aid of oxygen enhancing components. It's a professional treatment only. The oxygenating and the lightening kind of go hand in hand. The oxygenating effect helps to deliver the nutrients of the lightening nutrients faster and deeper to the cells. AHA fruit peel, with the combination of layering the Hungarian paprika treatment over the top of the AHA fruit peel. The fruit peel is a 20% alpha hydroxy acid treatment that provides a strong exfoliating effect with a combination of glycolic acid, malic acid, lactic acid, and salicylic acid. What you will do is perform this application in a layered technique. So the fruit peel will go on first. The paprika treatment will go over the top. The cucumber and parsley treatment combines a gel and an oxygenating talc that gets combined together in a bowl, and then you would layer the Hungarian paprika over the top of the oxygen lightening treatment. So the paprika is used as a catalyst or a boosting type of a product that helps to enhance the oxygenating effect of the treatment and can help with producing an even better effective treatment and boosting and enhancing the effects. Tomato suntan gel. Tomato suntan gel protects from damaging rays, but does not block the sun completely or entirely. It promotes healthy skin without burning, and it provides a sunscreen quality with titanium physical sun protection and also antioxidants in the tomato. Vitamin E, vitamin C, beta-carotene, and lycopene assist with the sun protection and help to protect the cells from UV radiation. It absorbs the rays and scatters and reflects the rays. It bounces off, regenerates, fights free radicals, does not prevent perspiration either. And perspiration, we need to perspire in order to detox. So it's actually very important that we do a little bit of sweating once in a while. All right, so what is the recommended treatment series? Here's what we recommend. For lightening treatments, a series of treatments is recommended, which can be done between 6 to 12 treatments. It depends on how severe the pigmentation is. So, depending on how deep the pigmentation is, which you will decipher at the time of the skin analysis and consultation, utilizing either your Woods lamp or your magnifying lamp tool in order to determine how deep the pigmentation is. If it's new damage, a series of 6 treatments sometimes is sufficient, but if it's older damage and deeper damage, sometimes you need to step it up to 12 treatments. The treatments can be given as frequently as 3 times a week, but it's best to alternate the AHA paprika peel, doing 1 peel and 2 lightening treatments a week, avoiding lightening treatment for 2 days after the AHA paprika peel. So what you're doing is you're going to give the skin a little bit of a rest in between the treatments for 2 days in between. Clients should continue lightening process with at-home care products, the products that we typically just reviewed, stone crop products, lemon cleansing milk, brightening serum, for example, on a daily basis. Frequent exfoliation with the yogurt power peel or the rosehip exfoliator also helps in the process. The yogurt power peel, if they're doing a series of treatments and they're coming to you multiple times in a week, will not need to use the yogurt power peel at home until they're done with their series of treatments, and they're coming only maybe monthly to support the effects of the treatment. Then they can use their yogurt power peel weekly after the series. Same goes for the erosive exfoliator. Improving the color tone in the skin requires a regular and persistent treatment. So it's ongoing, constantly, all the time. And never, I would decide if the client, if this is their main concern at the time too of the skin analysis and consultation. If this is something that they want to address, this is something that I would start addressing almost right away. And because it takes a little longer to help improve the condition, also especially in darker complexions, you have to take a more delicate approach, which takes a little bit longer. The fairer skin tones can do some of the stronger, more superficial peels. For a darker complexion, I would stick with your lactic type of peels, which are a larger molecule, they're less invasive, and have less risk of other types of damage and photosensitivities. But again, because it's their AHA peels, you definitely want to make sure that they're protecting with some type of sun protection. So that completes the PowerPoint presentation of the symptoms, causes, and treatments of hyperpigmentation. I hope you enjoyed it and learned some things that would help you with your hyperpigmentation clients. Thank you for your attention. And next I'm going to show you the Ilike Oxygen Lightening facial treatment. So please enjoy the facial demonstration. For just a moment while I prepare the webcam and prepare the model, I'm just going to mute my microphone and I'll be back in just a short, under a minute or so. Okay. All right, and we're back and we're ready to start the demonstration of the Ilike Oxygen Lightening Facial Treatment. So, hello everybody. We're going to start with our cleansing step, our first cleansing step. In most and all Ilike facials, we do 2 cleansings. And the first will be with your selection of cleansing milk. And we have about 5 different types of cleansing milks now. We're going to be using the lemon cleansing milk to begin with. A part of the lightening solutions that we have from our product line would be the lemon cleansing milk that we were just discussing. This can be your eye makeup remover, and it's also your facial makeup remover. It helps to remove impurities without dehydrating or compromising the skin's natural moisture barrier, and also has the lightening effects of the lemon and also the softening and refining effects of the apple. So what we're going to do to remove the eye makeup, and let me tell you a little bit about the supplies that I have with me so you're able to perform this treatment thoroughly. I have a bowl for water. I also have spatulas for dispensing product out of the jars. I also have some cotton-tipped applicators to help me apply lip balm and eye product. I also do have round cotton pads, and I also have some that are cut in half for the eye makeup removal. And I also have some 4x4 cotton wipes, aesthetic wipes. You can use these for applying toner and also for compressing masks. And pretty much you want also a bowl to mix up your cucumber and parsley oxygen lightening treatment. There will be two components, the gel and the powder, that you'll want to mix in the bowl. Everything else is applied by hand or can be dispensed from the back of the hand. Okay, so I'm going to take my 2 half-round pads and I'm going to dampen those in water. For the eye makeup removal, this is kind of a neat technique that helps you remove it thoroughly without the client leaving with dark circles under their eyes. So I'll open them up and have the client look up towards me, and then I'm just going to stick them right under the eye area, and when they're damp, they won't fall off. They'll stay in place. Okay, go ahead and close your eyes. So I'm going to take another round pad. I'll dampen that in water. And I'm going to take a pump of my lemon cleansing milk, which is safe to use over the eye area, so it's a 2-in-1 product. Pump a pump of cleanser onto the eye pad. Hold down 1½ rounds and gently skim over the eyelashes back and forth and down the lashes. You can also clean off the eyelid area, moving from the outer corner of the eye to the inner corner of the eye, and also over the brow to remove brow color. Repeat that 2 or 3 times. Once complete, you can remove the under eye round pad and then move to the other one. You can also then, if you need more product, you can turn over your cotton pad and then pump another pump of cleanser if necessary, depending on how much makeup they're wearing. Skim over the eyelashes gently back and forth. Brush down the lashes from the inner corner to the outer corner of the eye. Remove the eyeshadow, and then you can go back and forth across the brow to remove brow color. Once complete, then just simply remove the round cotton pad from underneath the eye. Now we'll start to remove the makeup on the face with about 3 pumps of lemon cleanser to begin with. You don't have to dilute the product in your hands with water, and you don't have to wet the face. We're going to use it directly on the skin dry to begin with. This product is an oil-based product. Oil removes oil, so it'll break through the makeup a little better before you do any dilution. If you have to dilute the product, you can add a few drops of water after massaging it in initially. Which I am going to do, and add another pump of cleanser. After your first cleanse for about a minute or 2, and following the cleanse, after removing the makeup, do your skin analysis with your Woods lamp or your magnifying lens. This way, you've removed the makeup and you'll be able to have a clear visual on what type of pigmentation she has and also how deep the pigmentation goes. After determining that, then you can decide on how many times she should come back for her treatments. Also, during that skin analysis and consultation, determine what type of Fitzpatrick the client is. Okay, and just simply remove your cleanser with a warm towel from the cabbie. Now I have the steam going because in my next cleansing step, I'm going to begin to steam the skin. I'll be using one of our exfoliating washes, the Nettle Exfoliating Wash. When you steam on top of that cleanser, it provides a really nice disincrustation effect. And we're going to use the the Nettle Exfoliating Wash, which does contain some lemon, so you have a bleaching and a lightening effect. Our exfoliating washes are designed to provide a light daily exfoliation. They soften and refine the skin and smooth the skin. They also prep the skin for deeper absorption of the treatment products that are going to follow. So this is a typical second step cleanser, and then also at home it can be used once or twice a day. Like the lemon cleansing milk, you can use it once or twice a day, deciding on maybe what texture the client prefers, and also too, it depends on the condition of the skin. I would say this is a great cleanser because it just provides more exfoliation, especially for someone that really is looking for some deeper hyperpigmentation that needs more exfoliation. Now, this is a hydrating cleanser as well. It has antioxidant properties. I did about 2 pumps of cleanser in my hand. Because I'm going to cleanse all the way to the décolleté and shoulders and neck, I use 2 pumps. But at home, if you're just going to the neck and face, it's usually just about 1 pump is all that's needed. They're very concentrated. You must dilute with some water in your hands and then rub the hands together till they become sort of white and sudsy or bubbly. Then the product is ready to apply to the skin. The exfoliating washes are not safe for the eye, so you have to be very careful around the eye area and do not get this product in the eye, otherwise it will sting. You can cleanse for about a minute or 2. Another tip during the second cleansing step is you can do a brushing with a Clarisonic brush or a basic electric rotating brush. One of the classic rotating brushes is also effective, or even a manual brush. This will provide an even deeper cleanse and really help to clarify the pores, and also stimulate a little bit more exfoliation for you as well. When you're finished with your cleanse, you can use another hot towel from the cabbage to remove the product. Steaming is a great way to sort of ignite the product in the exfoliation process. It also helps emulsify oil and congestion in the pores, and it helps to open the pores. So if you're going to do any extractions during the facial, this is a great time to do your steaming prior to doing those extractions, and also during the exfoliating wash. The next step is to tone the skin after cleansing. We'll be using the Stone Crop Toner to balance the pH level of the skin, and also to provide for better moisture absorption. It also has aromatherapeutic benefits. It charges the skin with vitamins and nutrients. And I'll show you how to apply our toners. There's a few different ways that you have choices to apply the toner. So I am going to omit the steam for now. And I'm going to show you 3 different ways that you can apply the toner. They come in the 4.2 ounce spray bottle toners. This is the Stone Crop toner. It's going to assist with lightening and bleaching the skin. So I'm going to spritz the client for a nice hydrating application. Cover the client's eyes with your hand. Also instruct the client to make sure that the mouth is closed. And all you need to do is just spray once or twice. That is enough product to properly tone the skin, and you can use your hands to press the product in. These are highly concentrated products, so only a small amount is needed. Cup your hand for another type of application. It's a hydrating splash. You put 1 pump of toner in the hand, and then simply press that into the skin. Or you can use your 4x4 aesthetic wipes, your cotton pads, and spray those onto the cotton pads. And then simply sweep this across the skin, hand over hand. Fold your pads so you work in the smaller areas of the face, like along the sides of the nose, the mouth, and around the eyes. And lift off when you're at the temples. It's a nice way to say I'm finished and I'm moving on to the next step, which will be the exfoliation step with the yogurt power peel. The yogurt peel is, again, our 20% lactic acid peel. It can be used weekly as an exfoliator at home. But in your treatment series, you might be using this multiple times, a couple times in a week. If you're doing the series of cucumber, parsley, and lightning treatments and alternating with the AHA, you would do the yogurt power peel and then follow with the cucumber, parsley, lightning treatment as your mask. The next couple of days, you'll do the AHA paprika peel with your choice of mask could be the Stone Crop mask to follow. And then in a couple of more days, then you would do another lightning treatment with the yogurt peel. So I'm taking a very small amount of the yogurt peel. A thin see-through application is all that is necessary to apply this product. Now I prefer to apply my yogurt peel with a brush. A fan brush will get a really nice thin, even application. So that way you don't have to overlap the product either. We do not want a thick application. Now this product is an alpha hydroxy, so it is going to tingle. You want to also be careful for anybody that has any cuts or burns or braided skin. And also if they have any acne lesions that are open or been picked at, if this hits that open wound, it's going to sting. It's not going to feel too comfortable. The effects, the lightening effects of this peel are immediate. And with a series of treatments, you're going to notice a really positive progression in the reduction of the hyperpigmentation. Now, if there is hyperpigmentation on the décolleté area, especially from the chronic sun exposure, especially, a lot of times with sun damage, you'll notice it's on the forehead, the bridge of the nose, and the cheeks, and also along the shoulders and the décolleté area. UV tanning, it can probably pop up anywhere pretty much on the face and the neck because it's so much stronger. The bulbs are even so much, the UVA rays are even stronger in a tanning bed than they are from the sun. Okay, then I'm going to take a 4x4 pad. I'm going to dampen this 4x4 pad, and then I'm going to spray it with Stone Crop toner. And the reason why I'm doing this is I'm making some nice aromatic eye pads to protect your eyes from the product and also provide a nice soothing and calming effect, the aromatic benefits of Stone Crop. So we're going to leave this to sit anywhere between 3 to 5 minutes. 3 minutes for someone who might be their first peel, or they're a little bit more on the sensitive side, or if they have a thinner, delicate skin. This peel really isn't recommended for sensitive skin types. This facial period just isn't something that we recommend for a truly sensitive skin or hypoallergic skin. We have other kinds of facials that would be ideal for that type of client. Again, because we're addressing hyperpigmentation, the treatments are going to be slightly more aggressive than other treatments that we provide from our product line. During the affecting period, some of the options that you can do to keep the mind off the tingling sensation and some of that stimulation they're feeling from the yogurt peel is to do a shoulder and neck massage, or even a foot and leg massage is also a really nice touch too. I'm going to use our keratin massage cream, and I'm going to go ahead and just do a really nice little shoulder and neck massage. You get some wonderful, beautiful aromatic aromatherapy benefits from the keratin massage cream. It has calendula and lavender. There's also flaxseed, which is a phytoestrogen. And estrogen stimulates collagen production as well. So you're getting a nice tightening and an elasticizing effect from the keratin massage cream. So it's an anti-aging product, plus a massage cream, and a soothing and calming massage cream all at the same time. Now check with the client on how stimulated they do feel by asking the client on a scale of 1 to 10, 1 being the least amount of stimulation, 10 being the most. How do you feel, Claire? A 3. 3 to a 4, which is good. And I think that's enough. You know, that's a good amount of stimulation to feel, feeling a little tingle. You know, once they're up to around 6 or 7, and if they're at a 6 and 7 within the first minute that I have that peel on, I'm going to take it off at that 3-minute mark. Because she's at a 3, I can probably more than likely be safe to keep that on for the full 5 minutes. Now remember, you notice how I turned off the steam. We don't want to use any steam during the peeling process. The peel works and it's active on its own. You don't need to use the steam to activate it or to get it to work better or anything like that. And we don't want to massage it in the skin either. That's why I brushed it on instead of using my fingers. It is a very low pH peel. Its pH is around a 2 to a 2.5, so it's fast acting and it works all on its own. It doesn't need any help. You don't want to leave this peel on too long either, because it doesn't stop working after the 5 minutes. It's going to continuously work until you take it off. So what we're going to do is we're going to take off the product, and you can either use your towel from the caddy, but what I would recommend is that you cool that towel down to about room temperature before you apply that onto the skin. Or use the 4x4 aesthetic wipes. The towels that I'm using are a really nice soft microfiber. It's not a terry cloth. So it feels pretty comfortable removing a peel with this type of material. If you have a thicker terry cloth towel, I would opt for the 4x4 aesthetic wipes to remove the peel with cool room temperature water instead of using a thicker rough terry cloth to remove product after this peel. Let's take off the eye pads. After removing the yogurt power peel, we're going to do a toning application with the Stone Crop Toner. I'm going to take some cool, damp, moistened pads and spray them with Stone Crop Toner. This will neutralize the peel, and it'll also help to soothe and calm the skin and balance the natural pH of the skin after the exfoliation. If there's a slight tingling sensation when removing the peel or doing this toner step, it's just because the change in pH is happening, and sometimes when neutralizing, there's a little tingly sensation, and then that fades away. Sometimes people don't feel that at all, so it just depends. This step will also ensure that you remove all of the peel, and so that way no product is missed during the removal. All right, so the next step is to do our massage with the keratin massage cream, or you can also do the Saponaria and Linaria massage cream. The Saponaria and Linaria massage cream is a wonderful tool for disencrusting the skin, softening impacted pores that are clogged, and that needs removal of comedones or blackheads. When you're removing those open pores, you need a tool to help soften the impaction. So Saponaria and Linaria is our massage cream that the two herbs work together to soften the congestion, and then you steam on top of that massage cream in order to produce a more effective disincrustation treatment. You steam on top of it. It kind of is a trigger, and it kind of ignites that whole softening process, and it helps to open and relax the pores, so your extractions are much easier and also more effective and less damaging to the skin. So we're going to use the keratin massage cream for her massage. You can also use this one too, or the Saponaria, either one. My massage is going to be gentle. It's not going to be a vigorous massage. Because we use a peel, and we also are going to do a stimulating mask at the end of this facial, I'm going to opt for a little bit more effleurage massage and a little bit more gentler types of techniques instead of a lot of kneading and tapping. I'm going to begin with some de-stressing massage movements here around the décolleté, the trapezius muscle, and the levator scapula. You can steam on top of the keratin massage cream if you wish to, as another option. This massage cream has a wonderful, beautiful, clean slip. It's really easy to work with. And it really provides a really beautiful aromatherapeutic experience for your clients. And it promotes de-stressing and relaxation. I'm now massaging with my knuckles at the trapezius muscle, and then using my knuckles to massage the back of the neck. I'm doing some longer effleurage massage called a full circle with a half circle move, moving counterclockwise. Walk across the neck to switch directions, moving clockwise this time. And I'm moving my hands down to the chin to work on some firming movements along the mandible, doing a little bit of petrissage. Up to the zygomatic arch area. And walking across the forehead to complete petrissage on the left side of the face. And up at the zygomatic arch again. Come down to the upper and lower lip and massage with scissored fingers and figure eights underneath the chin and slide across the upper and lower lip. And we completed another full circle, half circle. This time the half circle lifted up from the chin to the temple instead of on the décolleté. And we're switching directions. Massaging at the triangularis muscle now with some rolling movements at the corner of the mouth, out on the laugh line, and then up the side of the nose and the nasolabial folds. Repeat 2 to 3 times. Massage the cheeks, walking from the inside of the face, the center of the face, to the outside of the face by the hairline and the earlobes, and up to the temples. And we're just doing the same set of rolling movements on the left side of the face. And massaging the cheeks, walking from the center of the face to the hairline, earlobe, and temples. And I'm going to finish the massage with some relaxing eye movements. I'm going to begin with massaging the forehead with the heels of my hands. And I'm going to move to the corrugator muscle and massage at the center between the brows by the third eye. And if you see vertical lines here, this is a great time to work on those. Doing some wrinkle ironing techniques. You can also do zigzags on the forehead, corner to corner, with your middle fingers from temple to temple. Above the brow, working on the muscle tissue above the brow, also in the corrugator muscle in between the brow. And I'm going to pick up the brows with my middle fingers, walking from the inner to the outer corner, stopping at the corner of the eye and massaging with 3 fingers. Inward and outward strokes, half circles under the eye, and then hold and stimulate pressure points by the temple and next to the corrugator muscle. And I'm going to complete the eye movements with piano movements and stimulating pressure points by the temples. Another piano movement, circles on the cheeks inwards and then stop at the zygomatic arch. Back up to the forehead, another piano movement, and then circles on the cheeks, stop next to the nostrils. Up to the forehead and end your massage with compression on the forehead. If you want to see more of these massage techniques, there is a massage DVD that is available for your marketing materials, or you can purchase it too as well. And that is on the order form. Wholesale list of products. You'll see in marketing materials that this is also available as for training tools. We're going to remove the massage cream with a warm towel. If it's necessary, proceed with extractions at this point after removing the massage cream. Perform your extractions, tone the skin to help remove any bacteria from the extractions, and then also to tighten the pores. And then you can also perform a high frequency application to help to cut bacteria from the extractions and also prevent the spread of bacteria causing breakouts. And then you can also utilize it for tightening the pores after they've been opened up and relaxed and cleaned out. And it also helps to penetrate product deeper into the skin if you want to use a serum underneath. Right, so we remove the massage cream. Now we're ready to blend the mask. And I'm going to go through the steps on how you would mix your cucumber and parsley oxygen lightening treatment together. So you have your gel and your talc. Mine are travel sizes, by the way. The regular size of the gel comes in an 8.4 ounce professional size, and the powder comes in a 4.2 ounce professional size. And it's sold together for one price. So I'm going to take, for lightening treatment, 3 parts of my gel. So I'm going to usually start with about 3 teaspoons. Put that in the bowl. Okay, and then I'm going to do 1 part powder. So I'm going to do about 1 teaspoon of powder. custom blending tip would be to add a splash of stone crop toner into your mix, or you can boost it and enhance it with the brightening serum. Either one works, but my favorite is the brightening serum. And use your brightening serum and just go ahead and pump that into the bowl with a spatula. You can do the same thing with the toner. Spray it right into the bowl. I would mix the powder together first with the gel before you spray the toner, so this spray doesn't make the powder fly all over. Or you can simply untwist the bottle cap and pour it in. Although it'll conserve a little bit more product if you just spray it. Then I'm just going to mix this together till the dry powder is all gone and it becomes this sort of white, frothy, bubbly mixture. You can use your hands to apply the product, or you can use a brush. Either one works. So this is about the consistency it should look. And I'm simply just going to use my fingers to apply the product. Again, because this is an oxygenating treatment, there'll be a slight amount of stimulation, some tingly sensations associated with the application of this product. And then we're going to layer it with the Hungarian paprika gel treatment, which is going to turn it into an oxygenating, detoxifying, anti-aging treatment that is going to trigger the lightening process and enhance the effects of the lightening. Okay. Once that is applied all over, you're going to use the Hungarian paprika gel treatment. This is the Hungarian paprika gel. And we are going to take about half the amount of what we used in that mixture. So I'm going to use about a teaspoon to a teaspoon and a half of paprika gel. And layer this right over the top. I just put it right on the back of my hand. Let the client know that they're going to feel stimulation in a few minutes, and it's going to raise the body heat, will elevate, circulation will increase. This will stimulate lymphatic flow and aid in detoxification, but also aid in the nutrient penetration. It is not an allergic reaction. It's circulatory. It's the same idea as if you were to go, it's like an exercise for your skin. So when a runner goes outside and he runs, or he runs on a treadmill, he or she, they're getting blood circulating and blood stimulated, and the body heat becomes elevated, they become warm and hot, and this is sort of that same similar effect. So I will apply eye pads again to protect the eye area from the paprika getting into the eye area, because that's not going to feel too pleasant. Eye pads with stone crop toner. Now we're going to let this sit for about 15 to 20 minutes for the best effectiveness for a lightening treatment. During that affecting period, make sure that you perform a relaxing massage of some sort. That helps to keep the mind off the stimulation. That really helps. I'm going to use the Stone Crop Stone Crop Body Lotion. The Stone Crop Body Lotion is a shea butter-based body lotion with the benefits and the lightening bleaching benefits of the stone crop plant. It also has aloe, so there's some soothing and calming and regenerative properties as well. And can be wonderful for not just for a post-sun treatment, and then also too just for hydrating and a light hydrating application. So I'm going to take about 4 or 5 pumps in my hand. I'm going to blend in our body oil, which is amazing, the Soothing Herbs body oil with yarrow oil, rosehip oil, lavender oil, just to name a few of the really awesome soothing and aromatic herbs. Blends really well with the Stone Crop Body Lotion. This will help with a little bit more slip during your massage. How are you feeling? You feeling okay? Yeah? Okay. Always check with the client to make sure that they're okay with the stimulation, that they're feeling all right. Now there is a little bit of contraindication to pregnancy with the Hungarian paprika gel. In the 2nd and 3rd trimester, I would omit the paprika. 1st trimester is usually okay. The stimulation from the paprika, unfortunately, is not very pleasing to somebody in their 2nd and 3rd trimester. It's a little bit too stimulating. So you can still provide this treatment without the paprika gel. You can see she's starting to look a little bit more flushed or a little bit more pink in the skin. You can see where I just went to the base of the neck, right below the chin with the paprika instead of all the way down onto the neck. The stimulation will feel much more comfortable if it only, comes to one, smaller percentage of the body. Although people who are more tolerant and get more used to the treatments may like or benefit from having the paprika come all the way down to the décolleté. And I would slowly progress them into applying more stimulation instead of doing it all at one time. So if you see the redness and the heat of the skin is starting to elevate even higher, which is completely normal, and that actually looks really good. It might be a little bit scary at first if you've never done one of these paprika treatments. If you've never had one or have never performed one, I strongly recommend that you practice it first on somebody who is not a paying client, so you get used to the application process, and you also have the treatment yourself, so that way you know how to describe the treatment best to your clients. That way there's no surprises. Also, never leave the room with this treatment on their skin. You always want to be in control, and you always want to be watching what's happening with the client and checking in with them about their comfort level. Another thing that you can do to make them comfortable is have a glass of ice water on hand with a straw, so you can just simply give them a little bit of a sip of water during the treatment if they feel a little bit too heated up and get a little uncomfortable. Fanning does not help this treatment cool it down. Some people believe that if you fan this product, like you can with peels, certain types of peels, that's recommended. This treatment is not a peel, it's a paprika treatment that actually, when you fan the product and then you stop the fanning, will actually increase the heat and the sensation and the stimulation even higher after you stop the fanning. So it becomes more uncomfortable even than it started before you did the fanning. So I just recommend just let it take its course. It's kind of like a little roller coaster ride. It comes up to a peak stimulation and then it will cool off. There are anti-inflammatories in the Hungarian paprika gel, like high mallow and lavender and horsetail, that have soothing and calming and anti-inflammatory effects. So capsaicin is another anti-inflammatory, which is naturally occurring in paprika. Capsaicin is used in medicinal treatments for therapeutic treatments for the muscles and the joints, like arthritic pain. So it really does help reduce inflammation. Even though it increases circulation, there are anti-inflammatories associated with this treatment. So we're going to go to the other side and massage the other side. You're starting to see that the skin is getting a little bit more pink. And you see the line of demarcation where I stopped and stopped at the line of where I was using the paprika. How you doing? You're feeling okay? Mm-hmm. Is it increasing now? I mean, is it going back down now from the highest stimulation? You feel it kind of calming down at all? A little bit, maybe? Okay. So she's feeling a little bit of the product starting to calm. So she's probably at the peak or just starting to pass the peak of the stimulation. Doing a really nice relaxing massage is really going to aid with keeping the mind off of the stimulation. It's much easier to forget about what's happening while you're stimulating other parts of the body and relaxing the muscles and helping her distress a little bit. So once you're ready to remove the product, it's going to feel pretty hard. It's kind of tight. It's oxidized. So it's going to feel it's a thicker layer of application. So it's going to feel very dry and tight. So my recommendation would be to remove the eye pads. You'll take about a couple pumps of the lemon cleansing milk in your hand, some water, and you're just going to perform a nice, quick cleanse to remove the product. It'll also help rehydrate it, so it'll be much easier to remove. Once the product is rehydrated,